Good morning, all of you. This is Dr. Mayank Kushrestha, working as a Senior Assistant Professor, School of Pharmacy, Department of Pharmacology, Babu Banarsidass University, Lucknow. So, today we are going to discuss the topic hospital and its organization, which is a part of the subject pharmacy practice. The paper code is BP703T, be from 4th year, 7th sem. So, here the content of this presentation is are definition, classification of hospital, primary, secondary and tertiary hospitals, classification based on clinical and non-clinical basis, organization structure of a hospital and medical staff involved in the hospital and their function. The earliest organized hospital of the world was perhaps the one in Tamil Nadu. The inscriptions found by the archaeology department in the Vishnu temple of Tirukomodal village, district of Tamil Nadu, gives detail about a 15-bed hospital exited 1000 years before. According to the inscriptions, the hospital was supervised by a physician who was given paddy, money, and a piece of land for the service retired. Two persons were engaged to fetch medicines, herb, and two nurses attend on the patients. The disease treated in these hospitals were internal piles, jaundice, dropsy, fever, disease of urinary system, tuberculosis, rheumatism, hemorrhage, colored urine, sperm disease, lung disease, and enlargement of spleen. In older days, physicians used to visit the house of a patient and treatment was carried out in the patient house itself in the indigenous system of medicine like ayurveda, siddha and unani. In those periods effort to have treatment in their houses, these hospitals were established by established by the physician and mainly by the travelers and pilgrims. Then came certain hospitals out of necessity like hospital for infectious disease, hospital for communicable diseases and hospital for mentally retarded people. Next came the hospital or squalid place for socially unwanted people like leprosy patient, temporary hospitals during epidemics like cholera, plague, smallpox, etc. These are the basic history of hospital. Medical science advanced rapidly. Diagnostic tools like X-ray came into picture. This has helped the surgeons who has specialized along with anesthetics. People as well as physicians started accepting hospital as places for diagnosis and treatment. At this junction, the role of hospital were restricted to cure and to rehabilitate sick persons. In recent times, this was to include promotional, preventive, educative function and also addition to other aspects followed earlier. These changes required reorientation of the thinking of health policy makers and planners, who had also to keep in view fast changing technological developments world over and their transfer within the country. Based on these, the central government as well as the state government laid down new health programs and policies, which in turn modernized the existing hospitals and paved way for establishing of more and more new hospitals. The government's primary commitment is to the patient as to the people of the future. The hospital have become a customer oriented institution and has to serve the masses. In a hospital, the pharmaceutical services are as important as having operation theaters or nursing services in the interest of better patient care. Hospital pharmacists should have a thorough knowledge of the drugs, chemistry, pharmacology, toxicology, biological aspects like bioavailability studies, pharmacokinetic, route of administration, stability, and related information so that he can be of great help to the doctors. The hospital is an excellent institution of an educational laboratory for physician and pharmacist. Pharmacists provide the information of new drugs and participate in their development in the clinical trials. He is one of the main pillars of the medical team. In order to meet the target of health for all globally, the pharmacist should get acquainted with the latest development that are taking place in the field of pharmaceutical and medical sciences. He and she should update his knowledge constantly from the technical literatures. Now we concentrate on the hospital. The hospital is a healthcare institution providing patient treatment with specialized medical and nursing staff and medical equipment. The best known type of hospital is the general hospital, which typically has an emergency department to treat urgent health problems ranging from fire, accident victims to a sudden illness. A district hospital typically is a major healthcare facility in its region with May beds for intensive care and additional beds for patients who need long-term care. Specialized hospitals include trauma centers, rehabilitation hospitals, children's hospitals, seniors geriatric hospitals, and hospitals for dealing with specific medical needs such as psychiatric treatment and certain disease categories. Specialized hospitals can help reduce healthcare costs compared to general hospitals. Hospitals are classified as general, specialty, or government depending on the sources of income received. Basically, the basic function of hospital, present day modern hospital fulfill the following functions. It provides for diagnosis and treatment of disease of the patient, both inpatient and out of the patient. They provide facilities for hospitalization. They act as a immunization center in the prevention of diseases. They coordinate various disciplines of medicines and improve the standard of medical practice. They provide advice on matters like family planning, STDs, AIDS, etc. for the improvement of social aspects and rehabilitation. They take care of the community at large and contribute a lot of the preventive and social medicines, and they educate the people. Apart from they act as a link between the masses and policies of government. They, by its early detection, treatment, and advice, lower the incidence of diseases. Smaller hospitals get cooperate from bigger hospitals. General hospitals get guidance from specialist hospitals where more sophisticated and costly equipment are available. Private hospitals cooperate with public hospitals, and all hospitals function in unison to achieve the same ultimate goal of health for all. They Bigger hospitals help in the growth of medical services by the training doctors, nurses, pharmacists, and healthy volunteers. Facilities are offered for research. So, these are the basic functions of hospitals. Now, we focus on the function of district hospital. It is an important support for health services and for healthcare in general in the district. It provides the wide-ranging technical and administrative support and educated and training for primary healthcare. It provides an effective, affordable healthcare service for a defined population with their full participation in cooperation with agencies in the district that have similar concern. Now we are focused on the classification of hospitals. Hospitals can be classified on various criteria. They may be grouped mainly as clinical oriented and non-clinical oriented. The main focus on classification based on system of medicine adopted for treatment. The examples are allopathic hospitals, Ayurvedic hospitals, Siddha hospitals, Unani hospitals, homeopathic hospitals, physiotherapy centers, natural care hospitals. Second one, the classification based on clinical orientation. The word clinical refer to the treatment of a disease in human beings. Different type of disease need different ways and method of treatment. Accordingly, hospitals are classified on the basis of major disease they seek to cure. For example, tuberculosis hospital, leprosy hospital, cancer hospital, mental and psychiatric hospital, diabetes hospital, maternity hospital, infectious and communicable disease hospital, drug addiction rehabilitation hospitals or center. Third one, classification on the basis of anatomical physiological specialization. For example, ENT hospitals, eye hospitals, kidney hospitals, dental hospitals, heart and chest hospitals, orthopedic hospitals, neurological hospitals, family welfare centers. Apart from that, the classification based on the type or group of people: maternity hospitals, pediatric hospitals, gynecological hospitals, general hospitals. This is the basic classification based on clinical orientation. Now we are move on the classification based on non-clinical orientation. Basically, non-clinical orientation, basically they are ownership basis. In ownership basis, the first criteria, ownership basis, again classified into central government control. They are military hospitals, railway hospitals, Jimper Hospital, Pondicherry, All India Institute of Medical Science, New Delhi, PG Institute of Medical Science, Chandigarh. Apart from that, state government control: General Hospitals Madras, Stanley Hospitals Madras, and various district headquarters hospital: JJ Hospital Bombay, Sassoon Hospital Pune, Osmania Hospital Hyderabad, Government Policy Hospitals, Victoria Hospital Bangalore, Vanivilas Hospital Bangalore, Sanjay Gandhi Institute of Rehabilitation Bangalore, ESI Hospital, C. Jayachandra Institute of Indian Medical Science Bangalore, Arignara Anna Hospital of Indian Medicine Madras. Apart from that, in non-clinical orientation ownership basis, the third category, municipality corporation controlled: BMC Hospital Bombay, KEM Hospital Bombay, Madras Corporation Hospital in various wards, Cooper Hospital Bombay. Fourth, private trust hospital, for example, Ramchandra Hospital Madras, KMC Hospitals Udupi, Bombay Hospitals Bombay, Jaslok Hospitals Bombay, Jindal Trust Hospital Bangalore. St. John Hospitals, Bangalore. Bhagwan Mahavir Memorial Jain Trust Hospital, Bangalore. The hospitals run by religious bodies: Hindu Mission Hospital, Madras, Ram, Ramakrishna Hospitals, Hyderabad, Christian Medical College, Vellore, Sri Varthi Math Hospital, Mysore, Minakshi Mission Hospital, Madurai, Saint Marathon Hospital, Bangalore, Baptist Mission Hospital, Bangalore, Chinamai Hospital Trust Hospital, Al Amin Trust Hospital. Next one, public limited control hospitals: Apollo Hospital Hyderabad, Vijaya Hospital Madras, Devaki Hospital Madras, Tamil Nadu Hospital near Madras, Bangalore Kidney Foundation Hospital, HMT Hospital, Sri Krishna Seva Ashram Bangalore, HL Hospitals. Now the private hospitals, nursing homes, there are plenty of these in the cities, the town owned by an individual doctor or a group of doctor, either on proprietary or the partnership basis. On late mushroom of polyclinics per 24-hour clinics has come up, making the government to think of bringing in some measure to check and regulate these hospitals. Now, the hospital based on bed number: large hospital they having more than 1000 bed, medium hospitals having between 500 and 1000 beds, small hospitals having between 100 to 500 beds, very small hospital less than 100 beds. On the basis of cost, we can classify costly hospitals, low budget hospitals, free hospitals, and last not the least, hospital attached to medical and dental colleges. So these are the basic classification of hospitals, and these are the simply a drug classification in which the drug are properly stored in a hospital pharmacy. So this is not the time of discussion. Next we can discuss the organization of a hospital. We have seen early that the hospitals are for the health care of the patient in various ways, like preventive, curative, advisory, like industry. Depending upon the nature and size of hospital, the organizational setup differ, but the main departmental, mainly the clinical services, will be common in all. And all other functioning like nursing, pharmacy, housekeeping, administration will support it. A typically hospital has the following setup. First one, the board of directors. They may be government, they may be corporation, they may be trustees, and they may be board of directors. Apart from that, the administration department. The administration department include the dean, director, executive director, or the chairperson. Apart from that, depend on the classification of the organization of any hospital, depend on the, if they the large hospital, if they the medium hospital, they depend on the type of hospitals. The Administration again classify into sometimes superintendent or sometime into different department. The superintendent again classify into the administration like accounts and finance, housekeeping, maintenance, purchase journal, public rehabilitation and laundry. And the clinical service again divided into the head of the departments, departmental head and deputy directors like clinical service, medicine, surgery, pathology, clinical lab, radiology, the special services like nursing, physiotherapy, dietary, pharmacy, the drug store, manufacturing, drug distribution, drug purchase, drug information, technical library. So this is the basic organization of the hospital. The chairperson director need not be a medical person. He is assisted down to the line by person who are professionally qualified and expert in their respective field. The administrator implants the policies of the governing council's policies. He and she is responsible for the entire institution, keeping in mind the highest standard of both service and economy with respect to medical and technical staff, the patient and the governing council policies. He and she play an active role between the medical staff and the governing council. He and she coordinate the work of various sections head of the hospitals. He and she does not interfere in the day-to-day clinical activities of the hospital but brings the lapses in conforming to the overall policy of the hospital to the notice to departmental heads. He and she forms the committees and heads most of them like professional committee, like finance committee, like purchase committee, like maintenance committee, like public relation committee, like training and updating committee. So these are the organization of any hospital. Now we can focus on the medical staff involved in the hospital and the function of that medical staff. The basic function of that medical staff to advise the governing body on medical affairs, to accept accountability of the quality of care attended to patient in the hospital, to request review and act upon report on medical staff committees, to circumstances the professional ethics of its member and to initiate corrective action as indicated, to develop, implement and review medical staff policies. All the hospital must have the medical staff responsible for all medical care to provide it to the patient. They may be divided into following categories. The registered medical officer RMO is available on 24-hour service basis on attend the patient and to the need of the hospital. Consultant and the medical practitioners expert in a specific area of medicine, they come to the hospital on specific days and time and available for consultation by patient. The visiting specialists are expert in the special branches of the medicine and practicing outside the hospital in their own clinic. The hospitals call them to attend specific cases and give their expert opinion in emergency cases and where patient cannot be shifted to his private consultation room. In other cases, the hospital may direct to the patient to visit their expert for examination by him or her to obtain their opinion. Coronary staffs are normally senior and retired medical staff. They have their own clinic but offer their coronary service to the hospital. They may be consultancy or for surgery. These doctors visit the hospitals regularly. The head of the departments. Competent expert staff are appointed as a head of the department. Nowadays, many hospitals prefer a full-time salaries person for these professional positions. Various departments that can be formed are medical division again into internal medicine, gastroenterology, endocrinology, infectious disease, skin and visceral disease, allergy, pediatrics, physiotherapy, geriatrics, immunology, nephrology, neurology, psychiatry, chest disease, and cardiology. The surgery division again classified into general surgery, dental and oral surgery, ophthalmology, otorhinolaryngology, gynecology, cardiothoracic surgery, nephrology, neurology, orthopedic surgery, plastic surgery. The function of head of the departments are send monthly report regarding the activities of his and her division to the director, maintain the quality of service of the division and take care of the hospital. They prepare budget for the division and future plans, give the requirement to staff to the work under him, overall responsibility of the department division. They participate effectively in the various committees to which he has been appointed as one member. Now, the clinical service. Clinical service means all activities surrounding the patient. It may be diagnostic, therapeutic, restoration, preventive, and advisory. These functions are same for both medical and surgery division. About 50% of the patient admitted admitted undergo operation. The maternity division. This is one of the division which is the vital to the hospital. All cares and precaution required for other division are applicable to this. Over and above this, extra care to be taken in keeping the identity of infants for avoiding mix-ups. Proper records should be maintained and the government authorities are to inform accordingly about the delivery and newborn babies should have trained people to handle newborn infant feeding. The laboratory service. Chemical and pathological laboratory must be fully equipped with the required instrument equipment. This is an important supportive division to clinical services. Here, sample of blood, urine, sputum, feces are tested for presence of pathological infection or abnormality in clinical parameters like sugar and urea content, hemoglobin content, total and viable count of blood cells, etc. are carried out. Disease like malaria, typhoid, cancer, syphilis are diagnostic on the basis of laboratory reports. Conditions like diabetes, anemia, tuberculosis are also detected on laboratory reports. Biochemical tests and report guide the physician and prescribe correct medicine to the patient. Radiology department. A radiology is in charge of the department apart from X-ray, radiography, and fluoroscopy also carried out here. Big hospitals will have sonography scanning, computer aided tomography, magnetic resources image, electrocardiogram added to the division. The dialysis division. In this department, dialysis is carried out with the help of dialysis equipment using a special solution for patient with kidney problem. The blood bank should be here. A drug license for the operation of the blood bank is necessary in form of 28 degrees centigrade. Conditions that are followed for these are whole time engagement of the technical staff who is a medical officer or graduate in medicine with 6 month experience. The space plant equipment shall be given in drug and cosmetics rule. Storage facilities shall be specified drug and cosmetics rule. GMP shall be followed strictly. Proper records shall be maintained. Proper testing facilities shall be provided with special instrument and suitable qualified person for testing. Emergency equipment and accessories shall be available. Shall follow the guidance set by the Supreme Court. Apart from that, apart from blood bank, there will be anesthesia service. This is the main supportive service to surgical department. A doctor who has undergoes special training is normally put in charge of this. He and she is responsible for proper administration of anesthesia before and during operation using the proper anesthetic agent and equipment. He is he and she is aware for restriction measure anesthesia safety regulation. Apart from that, the dietary services. Dietary services the main services. Food is required for the general uptake of person. The diet play an role in proper absorption of drugs. Food prepared and supplied in hospital must be free from contamination since patients have low resistance power to food infection. Food must be prepared very hygienically and must be nutritionally meant for specific disease or condition. Patients are to supplied food or diet thrice a day. About 1 month of these quantity will be required by visitors who are permitted to stay with the patient. Apart from the hospital staff or duty men require a cup of coffee or tea with small snacks. Team stock a centralized boiler will be ideal to the department, not only the cooker but also the steaming at the end of washing, cleaning of the used place, dishes, etc. Cleanliness and safety aspect must be followed strictly as per laid procedures. The housekeeping department, like home hospital, also required a housekeeping department. The activities of this department include floor cleaning, dusting, bed mopping, washing, window and wall cleaning, prepare the bed for new patient and also replacing the cover daily, maintaining the toilets and bathrooms, removing of trash and suitable disposal, journal sanitization, use antiseptic solution, vermin and pest control measure, linen service, washing and supply of uniform dress, bedspread curtains, cleaning and supply of sputum tray and urine bottles. Apart from that, the maintenance department also deal with the water supply, complete water work. consists of the different system: the collecting system, the purifying system, the distribution system. Means firstly the water should be collect and that purify with some different chemicals or different suitable agent, and the distribution system. And the distribution system, how the water will be distributed, it should be very carefully distributed. Or sewage, the sewage and sewage disposal, then how the sewage should be disposal. So they have a choice of disposal system. They have a effluent disposal and utilization, and the disposal system based on the type of waste, like solid waste and the liquid waste. And these are some different type of the very small service, but these services are very mandatory in the hospital. Apart from that, the hospital have a physiotherapy block, the pharmacy, the nursing, the healthy nursing block. So like this, there are a lots of different type of medical staff. As early I discussed, they are involved for the better properment or better future of any hospital. Health administration in one of the subject in the concurrent list of the consultation. Here there is a union ministry of health and the family welfare in the central government, so also a minister for health in the all state government. The central minister formulate the overall health policies and plans the new health schemes, is also offer financial assistance to the state government, central government and the state government health personnel. Hereby the given under the cabinet rank minister again classified into minister of health, state for health, the deputy minister of health and family welfare. Apart from that, the secretaries again classified into joint secretaries again classified into deputy secretaries, and deputy secretaries again classified into different type of person which take care about the hospital of a state or of a central government. So healthy system, each district is controlled by the district health officer or district medical officer or DMO. These officers are responsible for the administration of hospitals in their district and for the implantation of community health program of the government. They are assisted by the assistant district medical officer and primary health center in charge officers. In corporation and multi municipalities, the health officers report to the mayor or chairman respectively. So these are the basic of a hospital organization or criteria and classification of a hospital, and the classification based on clinical and non-clinical orientation, and the organizational hospital, how the hospital will be organization. Apart from that, the different type of division or different type of medical staff, like and like diabetics, like the diabetologist, like the physiotherapy, like the pharmacy, like nursing, like maintenance department, like housekeeping department, like clinical service, like maternity, like laboratory, like radiology, like dialysis, like blood bank, anesthesia, etc etc. So these are the important department of the hospitals, and they have a particular respective medical staff, and they give in service as their respective places. So these all are the hospital classification of hospital and medical staff of a hospital, and the function of medical staff. Thank you so much for patiently listening for this presentation. Thank you so much.